Okay.
Good evening, everyone. My name is Steve with Firefighter AT Ukraine, and in this video I want to talk to you about a very serious injury that we can do something about with the equipment that's in our individual first aid kit, and that's fractured pelvis. So we can have pelvic injuries during dismounted operations or while we're in vehicles, and it's important to treat this injury because we can lose a large amount of blood into our pelvis, and we can prevent further damage if we actually splint it. Now, when it comes to binding a pelvis, we need to identify that it's actually fractured in the first place. And how we're going to do that is we're going to approach our patient. We may have had other injuries as well. Make sure that we treat our deadly bleeds, take care of that airway before we start looking at things like pelvises. But when we assess the pelvis, we're just going to feel for that pointy part of our patient's hips. So right at the top of your hips, you'll feel that prominent point. If we just put our hands slightly below that, we're just going to squeeze in and towards the middle. If the pelvis is unstable or our patient experiences pain, we know that there's potential for a pelvic fracture, and that means that we're going to have to treat it. All right, so once we've identified that pelvis is actually injured, if we can, we want to maintain pressure on that pelvis. We want to hold that for as long as possible. We may need to give that up to provide a treatment, but once we've splinted it, this is the first thing we want to do, is manually splint that pelvis. So Ian's going to step in and hold that pelvis for me. Next thing we're probably going to need to do is get some of our gear out of the way. We can't splint a pelvis if we've got holsters or phones or equipment in our pockets. If we're going over uniforms and whatnot, we're all right. But as soon as we start trying to splint over top of gear, we're going to fail. It's a lot like tourniquets. We need them as close to the patient's body as possible. Now, there's no trick to removing equipment. All we want to do is do it as gently and efficiently as possible without really hurting our patient. So while Ian's splinting that pelvis, I'll just jockey the gun belt out from underneath my patient. Looks like our carrier is not really in the way, so we can keep going with treatment. We'll check for the pockets, make sure there's nothing in the way. And the piece of equipment we're actually going to use is that foil blanket, that emergency blanket that we can fit in our IFAC. And the first thing we need to do with this blanket is to fully deploy it. Now, when we bind the pelvis, we need a nice, broad blanket. We don't want it to be too thin, we don't want it to be too thick. If it's too thin, it's not going to capture the anatomy that we would like it to. If it's too thick, it's not going to provide the pressure we need. So with this blanket, just unfolding after deploying it along its full length should be sufficient. Okay, our blanket's ready to go. Now, depending on the surface that your patient is laying on, we need to find a way to slide this blanket up and underneath our patient's body into the position we need. And the place that we're actually aiming for is, I mentioned that bony prominence at the top of your hip where we want to squeeze just below. Where we want to line this blanket up is actually, if you put your thumb on that bony prominence, about one hand width down. That's where we kind of want the edge of that blanket. We want to try to avoid rolling this patient. We want to try to avoid any really sudden, jerky, big movements. But, like I said, depending on the surface, we may need to lift their body slightly. We may need to come down from the top versus the bottom. The idea is that we have to get the blanket underneath the patient. So I'm going to identify that pointy, bony prominence. I'm going to go about one hand down, right where Ian's hand is. And then I'm going to start working this blanket underneath. Now, if our surface is asphalt or gravel, we don't want to let this blanket get all torn up. We're pretty lucky because we're in a nice, comfy classroom with carpet. So we want to get half of the blanket on Ian's side, half of the blanket on my side, and now we're going to start working it up. So Ian's just going to give a little bit of pressure upwards. Perfect. It's lined up. I can split the pelvis while he grabs his edge. Okay, now we'll make sure that we both agree with the location. Okay, looks good. We've got about an equal amount on either side. Now the next thing we want to do is I'm going to take Ian's side, he's going to take mine, and we're going to pull pressure. Okay, at this point, we want to pull nice steady pressure. We're actually going to start twisting. Ian's going to take one more twist. Awesome. So now we've got pretty good traction or tension on this pelvis. Right now, if we've done it correctly, our patient should be experiencing some relief. We also want to keep an eye on the patient's lower extremities and look at the skin color condition. We don't want it to be too white or have that abnormal look to it, or our splint might be occluding blood flow. Okay, so now that we're at this position, Ian can hold that for me. We're just going to take some tape and we're going to secure the blanket to itself. Now we want to make sure that we don't have a bunch of loose tails that can get caught to undo our treatment. We can tuck these into the patient's pocket. We can tape them again. Just to keep it tucked safely away. With this one, we can even just tuck it in the patient's pants, as long as it's not just being pulled all over the place. Now, we need to realize that maybe we haven't used the best quality tape. We have to constantly be reassessing this injury because we don't want it to come loose. We'll give that a little bit of tape there, Ian. Keep that nice and secure. That's how we bind a pelvis.